and resources as well. So this is adapted from training that I did with a school. So quite often children and young people are referred to as pupils. So what is selective mutism? So the DSM-5 defines it as the persistent failure to speak in specific social situations where speaking is expected, despite the fact that they do speak in other situations. So it's a child who, or an adult, who can speak without difficulty in certain situations, but in other situations doesn't speak. So it's selective mutism is relatively rare, so it affects 1 in every 140 young children. But as we'll see, there's a higher incidence of selective mutism in the kind of cohorts that we worked with. So to have a diagnosis of selective mutism, it's got to affect the child's education, social and cognitive development. It needs to last for at least 1 month beyond the first month at school. So it's considered quite normal that when a child starts so this is talking about kind of early years kids. So when they start nursery or reception, they maybe will have a month where they don't really speak very much. But it's only considered to be selective mutism if it goes on for a month beyond then. So you're thinking like 2-3 months since they've started school, when we'd expect most children to kind of get into their stride and start communicating. So it's not, selective mutism isn't when a child doesn't speak because they don't know the native language. So if a Bengali speaking family come to England and that child wouldn't speak in school for a while because they're just learning the language. So it's not that. And also that child, if they spoke to a teacher who could speak Bengali, they would speak confidently in school. So it's not because they just don't know the language. And it's not, so this is a tricky one because children with selective mutism quite often do have additional communication difficulties. But I think this means that it's not that they can't talk in certain situations because maybe they're stammering and blocking. It's because they are reluctant talkers. They are too anxious to talk in that situation. Okay, so when is it not selective mutism? So it's not selective mutism if the child has the same limited speaking habits across all settings. So we need to see a difference for it to be selective mutism. So you might have a child who has really, severe learning disability. So they might be non-verbal or minimally verbal, or they might have very severe, specific developmental language disorder. So their language difficulty is really, really severe. So we need to see that in some situations they can speak in line with their general skills, and in other situations they stop speaking. So there needs to be that difference for it to be selective mutism. Okay, so we're going to think about why selective mutism occurs. So there's certain predisposing factors. So these are things that the child is born with, or genetic factors. And these are, predisposing factors can be the child already having a speech and language impairment. So talking is already tricky for them. A child who has a kind of predisposition to being very anxious, very wary and hypersensitive to criticism and people's attention. Also family history as well, of kind of that social anxiety, shyness, and also selective mutism in parents or family past. Family history of any other kind of psychiatric illness, particularly anxiety disorders. It's more prevalent with girls, and more cases tend to be from multilingual families. So it's more common in families who, especially first generation immigrant families as well. And again, generally with that kind of predisposition, children who have just generally poor self-esteem, who are anxious, and who have a real fear of making mistakes or taking risks. So precipitating factors for selective mutism. So these are factors that might occur in the environment around the child that precipitate and make it worse. So sort of traumatic events like starting school or leaving the family unit for the first time, a particular trauma, a separation, so a kind of bereavement, frequent moves or migration to a new country, being very self-aware of any language difficulties or speech difficulties a child has, and also bullying and other negative reactions. So kind of like bullying and teasing, which makes the child again very risk averse. and then perpetuating or exacerbating factors. So these are factors that make things worse or entrench the mutism, so make the selective mutism last for longer. So unfortunately, these tend to be things that parents and school staff and adults generally do when a child doesn't speak. So these, unfortunately, are things that make selective mutism worse. So putting pressure on the child to speak, reinforcing the mutism by kind of increased attention and affection. So they're maybe kind of like, babied or, taken under the wing by a kind of TA who likes that kind of caring role and actually doesn't challenge them in any way. So lack of appropriate interventional management, so there not being appropriate pathways in place in the child's setting. Over acceptance of the mutism, so again the child isn't challenged in any way. Geographical or social isolation, so again that's those families who who may have migrated to or moved to a different part of the country or moved to a new country and they are quite isolated. The family belonging to an ethnic or linguistic minority, so again that makes the family more kind of isolated, and unfortunately it can lead to a kind of culture in that family of finding the outside world quite threatening, which then is passed on to the children. And negative models of communication in the family, so for example having a parent who is very shy, who so the child would see parents who avoid going to parents evening, who avoid speaking to people in shops, that kind of thing. So the idea of kind of being shy, of being risk averse, is modelled to them but from parents and caregivers. Okay, so how not to treat selective mutism. So there's basically two kind of extremes. You don't want to avoid the problem completely, but also you don't want to put a huge amount of pressure on the child. You need to find a kind of a midpoint in the middle. So you don't want to avoid the issue, so you don't want to ignore it. You don't want to do everything for them and anticipate all their needs, but also you don't want to put loads and loads of pressure on the child, trying to make them talk, pressure, bribery, emotional blackmail, like, oh well, if you read your book then you'll get a sweet later, or oh but you'll make grandma so happy if you do bring her up and thank her for your Christmas present, or that kind of thing. Okay, I'm just going to check. I think some people are struggling to get into the Okay, so then if we look at what, so if we think about a scenario of a child being afraid of the dark and how that kind of avoidance and pressure and finding that midpoint of how you can help that child to kind of work through their fears and anxiety. So with a child who's scared of the dark, we can either avoid the issue, so we could just leave the light on for them all through the night. We could never leave them alone at night, or they could sleep in their parents' bed forever. So you never address the issue, you never put any kind of pressure on the child, but it just means that the issue carries on forever and the child never kind of is encouraged or supported to kind of work through their anxiety. You could also put loads of pressure on them, so you could just shut them in their dark bedroom every night, or shout at them, or belittle their fear, so kind of mock them for being scared, and make it clear they're not going to get any sympathy from you, which obviously is not the right way to go either. So it's finding that midpoint. So think about small steps that you can take and a graduated approach. So you could have dimmer or night lights, you could leave their bedroom door open, have the corridor light on. You could talk to them in a sensitive way and show that you accept their fears and anxieties and that you understand them and you're going to help them in a kind of gentle but encouraging way to kind of work through their fears. So how do we treat selective mutism? So a big one is reducing those perpetuating or maintaining factors. So I'll show you as well, there's a few quite nice handouts, and a lot of them are from the Selective Mutism Bible, which is by a lady called Maggie Johnson, who is a speech and language therapist actually, and that's got absolutely loads and loads of stuff in it. It's got really, really good it's got really good sort of checklists and things to go through, and things that you can give to parents and school, and that you can fill out as well when you kind of do an observation. So they're just really useful tools for kind of knowing how to get started when you're looking at selective mutism. Okay, so yeah, you want to reduce these perpetuating or maintaining factors. So the first one is reducing any pressure that's put on the child to speak. But instead, we're not going to ignore the issue. We're going to give the child stepping stones in the form of AAC, which we've talked about before. So that's alternative and augmentative communication. So they can use gesture. So maybe they raise their hand to answer for the register if they're too shy to say yes. Maybe they can use symbols, they could use Makaton. If the child is literate, they could write notes. So you're thinking about that zone of proximal development. So something that the child isn't going to find too terrifying, but something they'll find okay but challenging, that can kind of support them on their way to speaking verbally or communicating to their potential. Don't bring attention to the fact that the pupil doesn't speak, to the fact that they speak or don't speak. So as can often be the case. And I remember when I was at primary school, there was a boy with very severe selective mutism, and it was, it was part of his identity, and we would all talk about it, like, oh yeah, Richard doesn't speak, and our teacher would come in like, oh, he's not going to answer the register again, are you? And he would just be like squirming on the carpet, just hating every second of it. So I can definitely think in my experience, when I think back to my school experience, of very badly managed selective mutism. So don't bring any attention to the fact that they don't speak or the fact that they do speak. So if they are brave enough to maybe answer the register or do something, it shouldn't be kind of an enormous attention grabbing thing, because actually it might make them less inclined to do it in the future. So if they think, oh my goodness, that one time that I was brave enough to put up my hand and say, yes, sandwiches for lunch. Everybody made a massive fuss of it all day long, and I absolutely hated it. So I'm never doing that again. So just being completely neutral in your reactions to the child. And the really difficult thing is, especially with younger children, is encouraging the rest of the class not to do the same, or in a class where children have learning disability or autism who might struggle to understand. I know you find it really interesting that this child speaks or doesn't speak, but actually let's not talk about it, and let's just treat them the same as everybody else. So as much training as possible for everyone in the pupil's environment. So if possible, that kind of family holistic approach, training everyone in the school, having handouts, see how many kind of parents and family members can come to network meetings, or giving really clear handouts that can be given to everyone else in the family. Particularly, if the child is looked after by, older sisters or aunties and uncles or grandparents, just so they know what best practice is in how to communicate with that child, and also just acknowledging the difficulty with the child. So obviously according to their learning level, so something that's developmentally appropriate, just kind of acknowledging with them, this is a really difficult thing and we're going to help you. So it's not something that's ignored, it's not something that you're putting loads of pressure on, but you're keeping that midpoint of acknowledging it and talking about it in a kind of neutral and positive way. So in terms of how to talk about it, this can be really tricky. So making sure the child knows that there is no pressure to speak. Whenever I have a child who has selective mutism and I, do a home visit, or they come to see me, quite often they are kind of visibly shaking, because they're thinking, oh my goodness, I'm going to the speech and language therapist, they're going to make me speak and it's going to be horrible. Or if you do school visits sometimes, and you ask to see the child, it often turns out that child is conveniently off sick because they knew they were coming, or they're hiding in the toilets or something like that. And the first thing I do, and sometimes again, if it's developmentally appropriate, is I send that child a letter just to say, I'm coming to see you, just so you know, you don't have to speak. If you wanted to speak, that's fine, but I'm not going to expect you to speak in this session. It's not, that's not my job. I'm just here to, I can just chat to your parent or caregiver, and if you want to chat to me, that's absolutely fine, but there'll be no pressure, just so they know you can kind of put them completely at ease, so they kind of have that feeling of security and safety, that they can come to your session and actually kind of get something from it. Kind of explain to the child that that it's sometimes hard to speak with new people. Talk about the fact they're not alone, that lots of people find it difficult. Maybe of other children, adults who find it difficult to speak. Their difficulty won't last forever. And you know, so maybe if they've started a new school, or if they're young and they've started a new school, kind of explain, you know, that it's, you know, starting a new school is scary. It's not surprising that they're finding it difficult to talk and communicate. And then if appropriate, also acknowledging, you know, it's really difficult to learn a new language. You're doing really well. Wow, you're in a new country. This must be quite, it must feel scary sometimes, or if they're having difficulty speaking clearly, sort of just acknowledging everything with them and making sure that you, try and stay kind of fairly neutral in that kind of midpoint, and also just reassuring them that there is no pressure to speak. You know, we're going to work on these tiny steps, these little stepping stones, with that being the end point. So also building confidence and independence, so focusing on their strengths and interests. So if they have particular topics in school, kind of really encouraging everyone to, you know, so they have lots of time to explore those things, that those are the things that are focused on when you talk about that child. It's not, oh, the child who doesn't speak, it's the child who's really good at drawing people, or the child who's really good at PE, those kind of things. Thinking about other kind of like noise and sound making activities. So maybe having musical instruments, and you could have musical conversations that go back and forth. Avoid so people around the child should avoid doing everything for them, but finding that midpoint, so making things easier for them and trying to gradually fade away the support. Giving them jobs and responsibilities, so making sure they're not kind of left out, that they have things to do. You know, they go and pass on messages like any other child in the class, but they can do non-verbal things. So for example, if a child needs something, if a teacher needs something from another class, rather than saying to a child, oh, can you go and ask Mrs. Jones to, you know, for some sellotape, you can say, oh, can you take this sticky note and give it to Miss Jones? And the idea is that the other teachers in the school will have had that training, so they will know, I'm not going to expect this child to speak, and I'm going to accept this non-verbal way of communicating. You know, reading the sticky notes, oh, thank you for this is really useful, there you go, oh, here's a letter back, you know, to Miss Reed, that kind of thing. Maybe they could support a younger or less able child to do something, again in a non-verbal way, kind of encouraging kind of friendships and things where they can feel empowered. Artistic expression, and always accepting any form of communication, that we're not putting any pressure on them to speak. You know, if they put their hand up, or if they use a Makaton sign or point to a symbol, that's absolutely fine. Okay. And there's all sorts of other things about kind of desensitization, and I won't go through all of them. But there's things like, you know, kind of role play, sound making, kind of recording a message on something, voicemail messages that they can play to a grandparent, or things like that. There's all sorts of different things. So a kind of formal technique for treating selective mutism that would be carried out, supported by a speech and language therapist and or a psychologist, is the sliding in technique. I mean, if you have a school or professionals who feel confident to do this, maybe if they've got the kind of Maggie Johnson handbook guide to do this, but really it should be kind of guided by a speech and language therapist. But we'll come on to kind of why, particularly in our situation, why that's quite difficult. So you start off with a talking map, and I'll show you a picture of what a talking map looks like. So you're basically tracking who the child speaks to and where they speak to these people, and you could have a look. So for example, you might see this child is happy where in their classroom they won't speak to anyone when all the other children are around, but if there's no one else in the class, they would speak to their mum while they're in the classroom. So we could do a sliding in approach where, for example, at the end of the day, after everyone's gone, all the different peoples are gone, you could have 10 minutes where that child sits in their classroom with their mum, who's a kind of safe, secure person who they will speak to, and they could just do a puzzle for 10 minutes. And then gradually that child will get used to the idea of speaking verbally in the classroom environment. And then you very slowly slide in an extra factor. So it might be that the teacher, maybe after a few weeks, the teacher might say, oh, do you mind, can I sit in here and do my marking while you're doing the puzzle? And you do that for a few weeks until the child then feels happy to speak to their mum with their teacher present. And then gradually you know, the teacher might say, oh, can I come and join in with your puzzle? And then you basically build things up through that. You start off with a kind of safe, secure thing, and you add in, you know, the more challenging elements as you go through. And again, that really needs to be guided by a speech and language therapist and or a psychologist. So the Royal College of Speech and Language Therapists emphasises the fact that early intervention is what is needed. So early intervention, you know, in every instance is associated with better outcomes and a shorter time period of difficulty. So the child is likely to be selectively mute for a much shorter amount of time. And then obviously kind of having selective mutism will compound any other mental health difficulties the child has. So it can also prevent selective mental health difficulties in the future. Children picked up late often need, you know, it's obvious they need far more complex interventions because, you know, their mutism is entrenched within them and also their family and educational unit. And you can also have really, really severe long-term negative consequences with children who have selective mutism for a long time. So obviously children who, you know, have selective mutism maybe going through secondary school and beyond, that's when it's basically just really, really entrenched. So you need quite a big change to that child's life and lots of, you know, mental health and anxiety support to ever help them to make, to kind of make progress really. So yeah, early intervention is always the best way to go, as with everything really. Okay, so basic do's and don'ts are: do have patience, do use alternatives to talking, and do ask for help. So always, you know, for you guys, come to the speech and language therapist in the team and psychologists. So things not to do are avoiding the issue, but also putting too much pressure on the child, and don't bring attention to the selective mutism. Try and be as neutral as possible in your attitude towards the child and concentrate on their strengths rather than them becoming labelled and identifying as the child who doesn't talk. Okay, so the bad news is that in Birmingham, I would love to be corrected, and I would love it if anyone can tell me, actually, you know, you've completely missed this. Here's the selective mutism pathway in Birmingham, and it's brilliant, and I would love to hear that. But as far as I can tell, there isn't really a selective mutism pathway anywhere in Birmingham. So Birmingham Community SLT, you can look on their website. So they don't accept referrals unless there's also a very significant speech language communication need. And then on their website it says if there isn't a significant speech language communication need, refer to FTB. But as far as I can tell, no one at FTB knows about this, and there doesn't seem to be a pathway for it. And as far as I can tell, no one was kind of privy to that arrangement. So on the NHS website, it states that a diagnosis of selective mutism is made by a speech and language therapist and another mental health professional if needed. So already we've got an enormous barrier to children getting any kind of assessment and intervention, because in the first place they need to be seen by a speech and language therapist, and Birmingham Community doesn't accept the referral. And then so treatment such as CBT and anxiety work should be done through psychology. And I spoke to the clinical lead for selective mutism at Samwell, and they said that what tends to happen is the NICE guidelines for anxiety, because the DSM classes selective mutism primarily as an anxiety disorder. The NICE guidelines say that you should just follow, well, people just follow the NICE guidelines for anxiety kind of assessment and intervention. So there's a really mixed picture. It's really odd. And then also the fact that the kind of the Bible of selective mutism was written by a speech and language therapist, Maggie Johnson. There's a real disparity really of whose job it is to work on selective mutism. And ideally it's an MDT approach with a minimum of speech and language therapist and a psychologist. So good resources to look for are, so there is the Selective Mutism Resource Manual, which is absolutely fantastic, and I would really suggest that if we get more referrals for selective mutism, that would be a good resource to purchase. There is the Smart Centre, there's SMERA as well, so that's selective mutism. I can't remember what the what the acronym is for, and there's also the Royal College of Speech and Language Therapists. To people in the child's network. Ideally, you try and do as much training as possible with people in the child's network, but this is quite a good kind of handout or kind of first place to start with that kind of thing. And there are the checklists as well from the Maggie Johnson book, which are really, really useful for information gathering. So the first one is, so you're looking at a list of possible maintaining factors. So essentially, this is a list of strategies that don't work. So strategies that either avoid the issue or put too much pressure on the child. So you can kind of tick how often they're used by the child's network and maybe any kind of comments on there as well. So this could be used, you could kind of use it almost like a case history. You could talk to parents about different strategies that are used, or you can observe the child and tick various things off. And then Form 12 is an environmental checklist for education settings. So you can give this to the child's teacher, and it really helps. So that you can either kind of go through it with the teacher, you could do it with your observations, but it's really, really good to get the teacher themselves to fill this out, because it then helps the teacher to realise that, oh, actually, I don't do that, or I do that. This is a really good thing that we already have in place, or actually, this is something I need to add to what I do. So you've got things that support the child's communication, so giving them non-verbal, written or verbal means, for example, talking through a friend, to access all those communication functions, ways to help them participate in various parts of school, ways they're supported to develop social relationships and self-esteem, general support, and just general points again. So these are all in our Selective Mutism folder in the communication support. And then the last one is the talking map, which can look a bit kind of confusing and a bit complicated, but it's basically across the top here, you've got a list of places where the child will or won't communicate, and then a list of people to kind of people in that child's network who they will and won't speak to. So basically, so this is one that I've already filled out for a kind of fictitious child. So for example, this child will speak to their parent at home, yes. They won't speak to them in the classroom. They would speak to them in a quiet room in school. They wouldn't speak to them in a busy room in school. They would use a quiet voice when they're out shopping. They would use a quiet voice at their place of worship, so their church or mosque or temple. And they would speak to their parent. So their hobby is swimming. And they would speak to their parent, but in the changing rooms only. So basically, you can kind of tally across. So looking at this parent, they will speak to them in 1, 2, 3, 4, 5 places. So you kind of put a little number there. And then if you think about various kind of locations in the child's life. So if you think about a place of worship, so imagine this child goes to mosque, this child will speak to 3 different people in the mosque. So they would speak to their parent using a quiet voice, they'd speak to their other parent using a quiet voice, and they'd speak to their sibling. But when you go through everybody else, so their other siblings know, grandparents know, their teacher, so that's non-applicable because they wouldn't see their parent. And then you've got place of worship peers, place of worship adults. Also, actually, that should be 4. But yeah, you kind of tally them all up, and then you can look and say, you know, the strongest places and people. So the places and people that this child will have the most confidence speaking to are at home, in a quiet room in school, to their parent, sibling, to their teacher and their TA. And then you can start thinking about actions for that sliding in approach. Oh yeah, so that's the that's the way you might use a talking mat. Ideally, you would want to have, you'd want a speech and language therapist with experience of selective mutism to be kind of carrying out all the more in-depth stuff like a talking map, but it's the kind of thing you can be aware of, is, you know, as part of the assessment process. Okay, so that's kind of the end of the selective mutism training. So we've gone through what it is, what the causes and the maintaining factors can be, what are the kind of do's and don'ts, and also selective mutism in the context of where we are in Birmingham, which unfortunately is